Dame Julia, thank you for your time and many congratulations, first of all.
Well, thank you very much indeed, and as I must say, I'm amazed, but it's lovely.
Well, it's very, very well deserved. Now, you've got this award today for Healthcare Advocate of the Year, but you've been many, many things. You've been Chief Executive of the King's Fund, you've run a community health trust, very involved with patients, healthcare reformer. What is the thing that you're most proud of in terms of healthcare advocacy?
I think I'd have to say two things, and maybe even the beginning of a third. But the first thing I would say is in my time at the King's Fund, we ran a programme called Enhancing the Healing Environment, where we demonstrated that if you improve an area of a hospital, basically if you improve the environment, it is better for patients. They get better faster and they leave hospital sooner, and it's better for staff and you retain your staff. And I'm very proud of that because it's blindingly obvious on one level, but we actually demonstrated it, we've proved it, and I think that's made a huge difference. It's become a national programme. So that's one thing I'm hugely proud of. I'm hugely proud of something that I don't think we've fully succeeded in, but my very small part in a much more, widespread campaign to change the way that people with mental illness have been perceived in our society. And it's not about, taking care from the hospitals into the community. It's actually about saying, what can we do for people who are mentally ill and how should we regard them? And one of the things that I'm really pleased about is I briefly chaired a mental health alliance group, which was a whole lot of different organisations with very different views, mostly, not speaking to each other. But then having a real go at the previous government's health reforms in mental health. They were doing major mental health legislation. And I'm very, very proud of some of the victories we had in that. But the thing I'm proudest of is we managed to get a whole group of advocates for mentally ill people talking to each other and talking with a single voice. And I think that was a great thing to do.
If you became the Secretary of State for Health tomorrow, what would you do?
I think I would do three things. I would outlaw the use of the term bed blocker, because I think it's outrageous. I would be asking whoever it was who are the purchasers of health services. At the moment that's being transferred to GPs, but it's still with PCTs, and we've still got strategic health authorities. Whoever the purchasers of health services are, I would be asking them to look fairly at how services are purchased and not always look just to the shroud waivers. And the third thing I would do is say, can we be a bit more serious here about public health? That there are some things that we do know about how you can improve groups in the nation's health and the nation's health. And we are apologetic about some of it and absolutely passionate about other things. So we do lots about smoking. In my view, not really enough in a concentrated way about obesity. And probably because we're still lily-livered about what we say about the use of illegal drugs, probably not good enough on the prevention of real damage on illegal drugs. So I would say, if I was Secretary of State of Health, can we just be a bit serious about some of this health prevention and public health stuff?
Now, some of those campaigns, you mentioned things like obesity. Some of those campaigns are actually part of what might be called medical education.
Yep.
And now, that's where a lot of our audience come in, because they work for pharmaceutical companies and they are sometimes involved in medical education. What's your view of that? Because it's quite a hot topic at the moment, of the extent to which that pharma companies should be involved in medical education.
I have no problem with pharma companies being involved in medical education, provided that the education is, if you like, neutral. If the education is all about using a pill, as opposed to getting off your butt and taking some more exercise, I ought to be doing the same myself. If it's all about that, then I do have an objection. So it's whether it's loaded or not. But if pharma companies and others, as part of, and I would say this is part of corporate social responsibility, if they're going to do something that is, if you like, parallel interest, then that's great, and they should have some of the expertise. If they're using it as a way of advertising products, it's not on.
Two big things that are coming up in the NHS. One is the NHS reforms, and we've seen the white paper recently.
Yeah.
The other thing is the cuts, the budget cuts.
Yep.
How do you think they will change the NHS as far as patients are concerned?
I think it depends what actually happens. I mean, in terms of the reforms where the funding will go to GPs, it depends the extent to which the GPs themselves can group together and can, between them, purchase people, buy in people who know how to do the purchasing. In other words, to some extent, you'd need to reinvent fund holding or whatever. And that's not clear, it's too early. But if they can do it well, then it could mean that patients do extremely well out of their own local practice. It could, however, mean greater inequities, because some groups of GPs may be very much better at doing this than others. And at the moment, there's not a lot in the white paper, but of course, white papers never give you all the detail. There's not a lot about how this is going to be regulated, how it's going to be monitored, what the lowest common denominator is going to be. So I think that's one area where I'd worry. On the other hand, I think that money coming nearer the patient is probably quite a good thing. So that's the first thing. And secondly, on the cuts, well, it depends where the cuts fall, and it depends on the kind of cuts. Now, my own view is because we're ageing as a society, and therefore, as you get older, you have more things wrong with you, and you tend to have sort of chronic long-term conditions, many of which can be managed. I think we're going to have to do much more self-care, much more self-management. I think that despite the cuts. The question is, are the cuts going to impact on that? My guess is they probably will, and that we probably will have to do a bit more for ourselves, which isn't necessarily a bad thing. Or are the cuts going to be, which is what has been said but can't be possible, purely in management and just taking out layers of management? I do think there's some management that could go in the NHS, but I think on the other hand, people who criticise managers don't actually look at what managers do. And a very large part of what managers do is feeding the beast that is called government, who always want to know more information. I remember, this is back in the 90s, and it wasn't as bad then as it is now, but I remember in the middle of the 90s, we used to get things called executive letters from the Secretary of State. And if it got to more than 3 a week demanding information, I threw them away, which people thought was a completely outrageous thing to do. But our job was to run an NHS trust. It shouldn't have been to constantly feed the beast. And I think the problem has been so many different forms of regulation in the NHS. A lot of the management has been actually keeping all the various regulators quiet. And I think there's quite a lot to be said for some of that actually being merged and, rationalised. And that's not to say we don't need regulation, we do. But I don't know that we need that many regulators. I'd rather have a few very powerful ones.
Julia Neuberger, thank you very much. It's been a real pleasure.
Thank you.